Yes, Minister, I raised this issue last week with yourself about the crisis of the trolley crisis, the health service in this country. And I want to kind of differentiate between the personal and political. I think sometimes you've got to do that, sometimes in this game. But this is not a perennial problem. This is a systematic problem of our health service. And our health service is quite sick, unfortunately. And the reason why it's sick is because of neglect. And the reason why it's been neglected is the people of your party and the Fianna Fáil party over the last 7 or 8 years have made political choices that the health service is in constant crisis. And it doesn't have to be like this. I mean, the prime time programme the other night was horrendous. It was an embarrassment to be even a member of this Parliament. It was an absolute embarrassment to see people suffer needlessly when they shouldn't have to. And I'm going to be absolutely brutally honest here. That programme, obviously, I mean, it's obviously imprinted on in our minds, but it's going to be largely forgotten about the kind of the waiting times and all that. But what's not going to be forgotten is the reality of what people have to face. And this is what people have to face, and this is what our health service is about. And I'm going to read out these stats. And they are kind of hard for you, they're hard for anybody in this House that tries to live in this country, to try to have a decent society. And here's the stats that people have to live in this country. In January, 612 people were on trolleys at the height in January. Today, or yesterday, there's over 500 people on trolleys. We've the longest waiting times for CT scans and minor operations according to the European Health Consumer Index. Ireland is the worst of 36 countries for ease of access to health care. Since 2008, and I make reference to your party and the Fianna Fáil party, and this is the crucial point of all this, 1,600 beds were lost in the health service. 1,600 beds gone. Gone. Health staff overworked, underpaid, and constant battle of staff shortages. Morale on the ground. Absolutely on the ground. Patients waiting for years for surgery, as we've seen in the programme. Absolutely unacceptable. Unacceptable in 21st century Ireland. Waiting times for speech and language therapy, OT and physiotherapy. The list goes on and on and on and on. And this is because of a two-tier health system that we have in this country. And obviously the National Treatment Purchase Fund, that system just sells public patients to the private sector. It doesn't go any way of actually trying to address the fundamentals of issues of our health service. So, Minister, there's obviously something wrong. I mean, you stated that we spend €14.5 billion on the health service. It's a huge amount of money. But there's something fundamentally wrong if Ireland, according to the OECD report, Ireland spends the third most on health services in the OECD. It's a phenomenal amount of money, but we can't get it right. Why can we not get it right? We have to get it right, because obviously, anybody in this room, there's obviously people who have private insurance, but everybody in this country, most people are. The onus is on your party, you, to try to address these issues. And you can, as a person, okay, I'm not blaming you personally, but it's up to you to try to address these issues. Ultimately what we want to see is a universal healthcare system where it's not a two-tier system, where if you have money, you can jump the queue. In a civilised society that we all live in, that should not be the case. It should be universal, through central taxation, where people on the point of care should get access to health care, not because of the length of your pocket. And waiting times are an absolute scandal in this country. So, Minister, I'm saying to you, put your reputation on the line. Put your reputation on the line and say, look, like your previous ministers, to say, look, the trolley crisis, waiting times are absolutely unacceptable. And I give a commitment, if the same thing is happening this time next year, I will resign. Thank you.